Okay, well, thank you everyone for joining us today on our first monkeypox update. My name is Stephanie. I'm the Communication Specialist at the Yakima Health District. Hola a todos, gracias por acompañarnos en nuestra actualización de la viruela símica. Tendremos nuestra actualización en español a las 7, entonces aquí en vivo en Facebook. But we do want to take the opportunity to talk a little bit about monkeypox with our health officer, Dr. Neil Barg. And I do want to share my screen just to give a few updates on the recent data of monkeypox. Can you see my screen?
Yes.
Okay, perfect. So here in the United States, as of August 24th, 16,603 cases of monkeypox have been reported in the country. And in Washington State, 14 counties have reported monkeypox cases, and Yakima County currently has 5 cases of monkeypox. So we do want to talk a little bit more about what monkeypox is, how it spreads, symptoms, and how to reduce your risk. But we are seeing cases throughout Washington State as well as throughout the country and internationally. So if you do have any questions about monkeypox, please make sure to put them in the comment section, as I will be monitoring it throughout the update that we have here this evening. And we can try to answer your questions as well on here. And if you have other questions about other topics, leave them in the comments section as well, and we can try to answer those at a later time. But I do want to say thank you again, Dr. Barg, for being able to talk to us a little this evening about monkeypox. And I think we can begin with just saying what causes monkeypox and how did it get to humans?
So monkeypox is a virus that is similar to smallpox, but not nearly as dangerous. It used to be confined to Central Africa, where the animals, the non-primate humans that are there, it's a natural disease. Because of contact with humans, the virus is able to spread from the monkeys to humans, but it was always confined to that area. And now with travel, and the fact that people aren't vaccinated against smallpox, this very closely related virus called monkeypox is able to move from those areas that it naturally occurred to areas all around the world, as we saw with the map of the United States. So there's no state now in the United States that does not have some cases of monkeypox.
Thank you, Dr. Barg. And as we mentioned earlier, we are seeing 5 cases here in our county. So what is the current risk level here in Yakima County?
Well, it's relatively low, but as we saw with other viruses, as you get to a certain number, it starts increasing more and more. And whether it develops into a situation like Seattle, where there's almost 400 cases, really depends on how people evaluate risk. So avoiding the things that transmit monkeypox will prevent you from getting monkeypox.
Thank you, Dr. Barg. And I think that's very important. So reducing our risk, and that's one of the subjects and topics we will be able to talk about later in the update. So to begin to get a little bit more information on who is considered high risk of getting monkeypox, as well as how it spreads.
So the biggest group of people that are contracting monkeypox are less than 30 years old, because the smallpox vaccine was administered until 1979 and 1980. So anybody that was born before that got a smallpox vaccine. The reason that they stopped doing it is there were no more cases of smallpox. However, no one predicted that monkeypox would move from the non-human primates into humans and then subsequently disseminate with all the travel that people are doing. So once somebody with monkeypox is in your neighborhood, you have to have close contact with those people. So hugging for extended period of time, sleeping in the same bed, anything that brings the body into contact with the fluid from the blisters is able to spread the monkeypox. So that could also mean fluid on sheets and towels, but it would have to be fresh. Once they dry out, the virus doesn't last long. So if somebody took a shower, they have monkeypox, and you handled the towel, maybe used it to wrap around your waist or something, there's a chance it would spread in that fashion as well.
Thank you, Dr. Barg. So what we are seeing in Yakima County are individuals who were exposed to monkeypox with somebody who had confirmed monkeypox through that close and prolonged contact. And so does monkeypox, I know we talked a little bit about the different ways that monkeypox does spread. Does it spread in similar ways as COVID, or is it as infectious as COVID-19?
It's many times less infectious than COVID. COVID can be spread airborne in addition to droplets. But it's not a big deal on surfaces. So you really can't catch COVID from a pillow sheet or a blanket. So monkeypox really is limited to two ways: direct contact with the fluid from the vesicle, and also if you're very close into somebody and they cough on you. So they're talking like one or half a foot or a foot apart, and they cough right in your face. You might get it that way. Of course, they have to have monkeypox in order for that to happen.
Thank you, Dr. Barg. And again, for those that are just tuning in, we are doing our first update on monkeypox live on Facebook. So if you have any questions about monkeypox, how it spreads, or any other information that you would like to ask our health officer, Dr. Barg, please make sure to leave that in the chat, and I'll make sure to look at that so we can answer your questions. And to begin a little bit more then, for individuals to know and be informed as well, to know more about symptoms. So what are some of the symptoms that individuals may experience with monkeypox? And if they do have symptoms, what should they do?
So it starts with a flu-like illness. So you're not really aware that it could turn into monkeypox. But within a few days of having headache, muscle aches, fatigue, sometimes even fever, you'll develop a rash. There'll be red spots, not little spots, but maybe like a 1/4 inch in diameter. And they'll be at different places in the body. And usually they're not there all at the same time. So one area of the body, they'll have the red spots. Another area might be fine. The red spots then turn into what we call a vesicle, which is a little blister that has clear fluid in it. After a few days, that clear fluid will look like pus, but the vesicle will still be there. And there's usually a red base around the pustule. Then the pustule will pop and a scab will form, and the scabs will stay there for about a week. And when they've fallen off on all parts of the body, then you're not contagious anymore. And one of the interesting or characteristic things about monkeypox is it can start in one spot of the body and be already improving, and then start again in another part of the body. So it will come in waves. But keep in mind, there's not that many lesions. There could be 20 or 30 lesions total over the entire course of the disease.
Thank you, Dr. Barg. And we do have a little bit more information on our website we were able to create. I'm going to share my screen. So here, there's a little bit more information about monkeypox and some of the symptoms that Dr. Barg was mentioning. Here we have visual examples that are available, as well as a little bit more information about what are the symptoms those individuals can experience. So here we have that available in our yakimahealthdistrict.org/monkeypox for individuals as well. And I'll make sure to link these on our comments as well.
I might add that sometimes a painful ulcer in the genital area with swollen lymph nodes nearby in the top of the leg at the edge of the groin can cause it. So painful ulceration should be considered a possible start of monkeypox as well. So that's different from the vesicle, but it only happens in the genital area.
So it is definitely important if you are experiencing symptoms or having an unusual rash to seek medical help, as well as for evaluation and treatment. And if you don't have a medical provider, you can call 211. And now that we talked about symptoms, what groups are more at risk for severe infection of monkeypox?
The people that might develop severe infections usually have other underlying medical problems. So if they have cancer, leukemia, if they have their immune system's compromised from chemotherapy, for instance, or maybe they have a severe illness, some other illness, they're all at more risk for progressing to severe disease. Also, people that have underlying skin problems like eczema might have more severe disease. So it's something to keep in mind. Pregnant women, because they're relatively immunocompromised, that is, they have a weakened immune system, they're also at risk for severe disease.
And is monkeypox deadly, or what is the recovery period for monkeypox?
Usually takes about 2 weeks from the onset of symptoms for all the scabs to fall off. And at that point, you'd be fully recovered. With all the cases there are in all the countries that report them, there's only about 11 deaths that have been recorded. So it's very unlikely to die or become critically ill with monkeypox.
Thank you, Dr. Barg. So then for somebody who does end up testing positive for monkeypox, how long do they need to isolate for?
So it may be a little bit different for different people, but it's roughly 2 weeks, and it's very easy to tell when it's safe because all the scabs have fallen off. You might have a little mark on the skin, but when there's no scab left anywhere, you're not contagious.
Thank you. So it is important to have that time of isolation to prevent the spread to further individuals. And I'm going to go ahead and just check to see if we have any other questions or comments. But again, those watching us, feel free to leave questions that you may have about monkeypox, and we'll try to answer those here in our live update. So give me one moment. Okay, so now that we've talked a little bit about what monkeypox is, our current cases here in our county, as well as how it spreads and symptoms that individuals can look out for, is there any treatment available for individuals who have confirmed monkeypox?
So if you've been exposed to monkeypox, vaccine is available and will prevent you from getting disease if you have it within 4 days of your exposure, and it'll keep you from getting severe disease or disseminated disease if you have it after 4 days. And as far as treatment goes, there is an antiviral available called TPOXX, but it's in very short supply, and it's going to be reserved for people that have severe disease or are likely to develop severe disease with the qualities, or rather the qualifications that we spoke about earlier. And it will go through a complicated process, including signing a consent form, but it doesn't take that long to get the medications. So far, we haven't had to administer it to anyone in town.
Thank you, Dr. Barg. So it looks like there is treatment available for certain individuals who are at high risk of severe disease. And for individuals who are close contacts of confirmed cases, how are those being identified?
So the person who has it, and it's been confirmed, has to let the health district know that there's been an exposure. Of course, all that information is absolutely confidential. No one else will know. And it's similar to other reported diseases like syphilis, gonorrhea, and chlamydia. So it's all kept confidential. So if the person who has it lets the other people who they've been near know that they've had it, then those people will become at risk and could go get the vaccine.
And we do know that with the monkeypox vaccine, it is available at the moment currently for individuals who are considered close contacts of those who were exposed to monkeypox. Do you know if that will change in the future?
When the supply of the vaccine becomes large enough, we'll be able to vaccinate anyone that hasn't had monkeypox. And that's probably going to take a couple months. It's not that different from the COVID vaccine, which we had very limited amount and we had very high risk people get it. But then as the supply increased, then it was available to anybody.
Thank you, Dr. Barg. And again, on our website, yakimahealthdistrict.org/monkeypox, we do have a little bit more information. I know that's another frequent question that we do get a lot from community members about vaccine and who is eligible. So yes, currently vaccine supply is limited and being prioritized to high risk close contacts of confirmed monkeypox cases. So we'll definitely share more information as that vaccine eligibility expands. Okay, so now we'd like to talk a little bit more about how people can reduce their risk for getting monkeypox. What are some recommendations individuals can take?
Well, since it's spread by contact, people who you don't know well, who wouldn't tell you that they're having a rash necessarily, would be the situation. You know, if you're in that situation, you want to avoid close contact. And at this point, you really, it would be very effective because you need close contact to spread it. So big parties, for instance, where there's lots of people close together, would be more risk than, say, a small dinner party where there's 6 people in the room. So if there's a bar where there's a lot of dancing and people are coming into contact with each other, the risk would be higher than, say, having dinner at a restaurant sitting around a table.
Thank you, Dr. Barg. And I do want to just share my screen as well, just to provide a little bit more information about a graphic that we did share, that we're talking about like activities and what may be most risky and unlikely. So on our website, we were able to create this graphic that just shows different activities and rating them from most risky to unlikely. So that's another great resource for individuals to utilize. That's available on our website. And additionally, as more individuals have more questions, there are some fact sheets about monkeypox that you can utilize. Washington State Department of Health created a monkeypox What You Need to Know. So an in-depth information about what monkeypox is, symptoms, prevention, vaccination, and when to seek medical care. So information there. And then we also do have resources for parents too. There's another flyer that was created just to showing the difference between monkeypox and COVID-19 and a little bit more information for parents as well. I'm going to go ahead and check our Facebook just to see if we have any other questions or comments. And if not, we'll finish it off with a couple more questions that we do have that we've been hearing from community members. So give me one moment. Okay, and again, for those watching us, we are doing our update on monkeypox. So we have talked a little bit about how it spreads, what it is, symptoms, as well as when to get tested and evaluated, and more information about who is eligible for the vaccine. We did share a little bit more information on our yakimahealthdistrict.org/monkeypox webpage that has information and lots of resources for community members. This is a recorded meeting, so we'll make sure to have that uploaded on our YouTube, and it'll still be available on Facebook in case you all would like to see it later or share with friends and family too. But Dr. Barg, I think just to finish it off, a couple other questions. Are children at risk for monkeypox in schools? I know that's another question that we've been hearing from the community.
Right now, there are not that many children that have been exposed. So nobody's going to come into school yet unless they've been exposed and have active disease as far as spreading it. Now, that might not stay that way. There may be a babysitter, a parent, an uncle, an aunt coming from somewhere else that has it. So if that's the case, a child may get it and bring it into school. But I don't think that's, at this time, a highly likely scenario.
Thank you, Dr. Barg, for answering that question. And yes, we do have resources, like I had shared earlier, for parents as well, and other additional information about monkeypox. But it looks like that will conclude our update for tonight. Again, if you all have questions, even after this update is completed, feel free to leave them in the comment section, and I will try to make sure to check on those to have those answered, even if it's after this update or days later. So thank you, Dr. Barg, for being able to talk to us more about monkeypox and informing our community about all the resources and symptoms to look out for. And again, just a reminder, there's more information on our website at yakimahealthdistrict.org/monkeypox, and a recording of this update will be available on Facebook as well as our YouTube. So thank you everyone again for being able to join us, and we will see you for the next one.